Hello everyone, and welcome to the launch webinar for the Moving Policy Index. My name is Dr. Kate Allen. I'm the Science and Policy Advisor at the World Cancer Research Fund International. The aim of the Policy Index is to provide an overview of the current state of play of physical activity policy across Europe. And it's part of our WCRF contribution to the EU-funded Co-Create project. And you'll hear more about Co-Create shortly from Knut Inge. As you may know, WCRF International focuses on cancer prevention and survivorship through diet, weight, and physical activity. And we know from our own work and that of others that physical activity is strongly protective against a range of different cancer types. And it also helps to prevent against weight gain. So for these reasons, one of our 10 cancer prevention recommendations is focused on physical activity. But despite these recognized benefits, globally, 28% of the adult population and over 80% of adolescents are not meeting the WHO physical activity guidelines. There has been a focus on physical activity in recent times by policymakers because of the COVID pandemic and the lockdowns. And member states are signed up to achieve a 15% target, a reduction in physical activity by inactivity by 2030. But as the numbers stand at the moment, that looks quite a tall order. We know that physical activity patterns established during childhood are important and tend to track through into adulthood. So it's really important both from a general health perspective and also from a cancer or other NCD prevention perspective to promote physical activity during those important early years of childhood and adolescence. We know from a policy perspective what's effective in terms of helping to create environments that enable people to better integrate physical activity into their daily lives. And yet, despite that knowledge, we still have the situation where vast quantities of people are not very active. So that knowledge isn't getting translated through into practical outcomes that could, for example, help achieve that 15% target. So it's really important to look at what countries are doing from a physical activity policy perspective, to look at where they're doing well, where they're not doing so well, where there might be gaps, where there might be opportunities, importantly, where improvements could be made, and also really importantly, where countries can learn from each other and see what each other are doing. And all of that is captured within the Moving Policy Index. A couple of housekeeping things. The webinar is being recorded, so people who are not able to join us will be able to catch up with it. Those of you who joined us yesterday for the Nourishing Policy Index launch around nutrition policy, that webinar will also be available. So in the coming days, you'll receive links to both of these webinars, and please do circulate them to your networks, to any of your colleagues that you feel will be interested, because we really want to get this information out there as widely as possible. After the speakers have presented, there's also going to be a Q&A session. And you can post your questions in the comment box during the webinar. So please do send us your feedback, your comments, your reflections, your questions. So it now gives me great pleasure to hand over to Professor Knut Inge to say a little bit more about Co-Create and also to chair the webinar. Knut Inge is the principal investigator of the Co-Create project. And he's also an executive director at the Norwegian Institute of Public Health, the NIPH. And both the Moving and the Nourishing Policy Indexes are a collaborative project between WCRF and the NIPH. So thank you very much for your attention. And I'm pleased now to hand over to Knut Inge. Thank you.
Thank you very much, Kate, for this introduction, and welcome everyone to this webinar. So briefly about the Co-Create project. It is a large EU-funded research project confronting obesity, co-creating policy with youth. And in this project, we aimed at working with young people, both as partners in the project and throughout the project, working with different groups of young people in focusing on policies that might help prevent obesity. And in particular, we were interested in how young people perceive different policies, what they think are important policies, and how that might supplement what is already in place. But what is in place then? A main objective of the project, and if you show the next slide, we see that monitoring and benchmarking relevant policies really have been a key objective of this project. And we wanted to see how this then might relate to changes in our weight that we could observe over time. And we wanted to see how this works across different European settings with different policy environments. And this then fed into how we worked with adolescents, mobilizing them, providing information, and also having them share their experience and trying to see how these different policies act together and influence their daily activities. So in this webinar, we are really focusing then on the monitoring aspect and on physical activity policies that are in place in Europe. There are no gold standards when you do policy assessment like this, and particularly when you set up a benchmark to try to see what should be appropriate policies that politicians or decision makers, both at government level, national level, and local level, are responsible for. So we really set out then working both with young people and different stakeholders to create valid and reliable and easily accessible methodology that could be used to monitor and benchmark physical activity related policies. Next slide. And we also wanted to see how this then directly or indirectly can influence what we call energy balance related behaviors, basically eating behavior and physical inactivity. In the project, we've also had a strong focus on social inequality and to see how policies can then help reduce social inequality across different groups, and both across and within countries. So at the webinar today, we will have a presentation of this policy index. Next slide, please. This will be given by Dr. Joanna Vlad from the World Cancer Research Fund International. And then we have an exciting panel with a representative from different levels, WHO, Europe, a national perspective from Portugal, and also a perspective from an important advocacy group. So we'll get back to those, but this will be the flow of the webinar, and then we will also have time for question and answers towards the end. But first then, it gives me great pleasure to give the word to Joanna Vlad, who is with the World Cancer Research Fund International, and she will present the main findings of the Moving Policy Index. Thank you.
Thank you, Knut Inge, and hello, everyone. So I will walk you through a brief overview of the main findings of the Moving Policy Index as outlined in our Moving Policy Brief, which presents the physical activity policy status in 30 European countries. Next slide, please. As we've heard previously, the problem that sits at the core of the Co-Create project is childhood and adolescent obesity across Europe and its impact on health. As we know, government action with regards to promoting physical activity is key, but is also insufficient. The Moving Policy Index was developed to look at the interaction of physical activity policies taken by national governments and to provide an at-a-glance assessment of the status of physical activity policy by assessing policy design of currently implemented actions against aspirational policy attributes. And I will say more about what we mean by aspirational attributes shortly. The Moving Index is a tool for policy advocacy mainly, and in particular, it's targeted at civil society, including youth groups, in line with the focus of the Co-Create project, to support them in advocating for better policy design in physical activity. But it is also a tool for monitoring and accountability of policy action by national governments to be used by researchers or policymakers. Next slide, please. The index is a part of a set of tools that can be used either independently or together to monitor, benchmark, and compare national government physical activity policies. And I will briefly go through the process of producing the Moving Policy Index, which was quite long and detailed, but it includes, first, identifying key policies. And key recommended policies were identified and brought together through the Moving Policy Framework, which brings together a set of policy actions for the national government, which they should take, and that together make up a comprehensive approach to physical activity policy for prevention of obesity-related NCDs. As a second step, we searched and identified policy actions currently implemented by 30 European countries, the results of which are available in our Moving database. And yesterday you learned more about its sibling, a Nourishing database housed on the same platform, as well as the Nourishing Index, as you've heard. Just a note about how we produced and how we sourced the policies, including in our Moving database. So we carried out an in-depth search for national level and government-endorsed policy actions that are relevant for reducing obesity and diet-related NCDs by promoting physical activity, and related to one of the policy areas of Moving. We don't only source these policies. Before we add them to our database, we verified them with an in-country expert, and these were civil servants or researchers at public institutions in the countries that we scanned. And third, when policies were collected, they were analyzed with regards to their policy design via applying our Moving benchmarking tool. The benchmarking tool was developed as part of the Co-Create project to provide a value on the strength of policy design based on applying standards or benchmarks made up of aspirational attributes. That means we don't look at comparing countries with what model countries are doing, but we assess policy design based on standards that are derived based on extensive research, review of literature, as well as expert consultation. So you can consult our aspirational standards in full by visiting our website, and there will be a link in the following slides for you to use as well. And finally, we compared countries, in our policy index and analyzed this comparison as part of our brief for each of the 6 policy areas of the Moving framework. Next slide, please. So to recap, we have a set of policy tools that were developed as part of the Co-Create project to monitor and assess national government policies, therefore to hold national governments accountable for physical activity policy for an NCD prevention. These tools are self-standing, but they can feed into one another to produce the Moving Policy Index. The index findings were produced in 2 stages. First, we produced benchmarking scores, which include both a value of 50 if a policy is present, plus the average of design attributes. Second, we produced policy index scores calculated as the average of the benchmark score within each policy area. Finally, we categorize these results as shown there with a score across 5 categories, with a score of 100 indicating all aspirational standards were met and 0 indicating that no policies were identified at national level. You can read more about the development of the moving benchmarking tool in our obesity review paper published earlier this year. Next slide, please. So to summarize, the comparative findings are presented and analyzed in our moving policy brief, as shown there, with an overview of the 30 countries that were included in the index. And if we go to the next slide, we also produced country snapshot, 30 of these, which present a more in-depth look at each country at benchmark level. You can see there the example of Slovenia, and you can also consult all of our country snapshots on our website if you're interested in any particular country. Right. Please note that we produce these snapshots. To produce these snapshots, we didn't only verify the policies sourced for our databases, but we also shared the results of the country snapshot findings once the policies were assessed to produce these. So we shared the country snapshots with our country contacts who had verified these policies. So as of today, we received feedback from 18 out of the 30 country snapshots produced. Once we received these feedback, we only updated the country snapshots after reassessing policies for inclusion, if necessary, as well as applying our aspirational standards again. I would say we're at the start of this process. We are asking countries that did not get in touch with that, especially one of the 12 that have not done so, to do so. And we would also like to continue to engage with countries at national level, whether it be national policymakers, researchers, or civil society groups. So let's look through the main findings of the policy index. If we can move to the next slide, please. Across the 30 countries, we found that national governments have taken most action and implemented best policy design in 3 policy areas of the moving framework. That includes first, opportunities and initiatives to promote physical activity in schools, the community, and sports and recreation. And we'll look more in depth at this policy area next. We also have policy area O on offering physical activity opportunities in the workplace. And here, only 5 countries received a good assessment. These are Greece, Ireland, Lithuania, the Netherlands, and Norway. And 1 country, France, achieved an excellent assessment due to policies on physical activity in the workplace and training for non-healthcare professionals supported by legislation and regulations. On average, policy assessments across the remaining countries received a moderate assessment. Finally, we have public communication policies which build behavioral change skills, policy area N. And here, this is the policy area that received the most good assessment. So 10 countries got that. Those were the countries that adopted physical activity guidelines that were also accompanied by well-designed public awareness campaigns, specifically that used social marketing, focused on inactive population segments, and that pointed to services or environmental changes to support behavioral change. The remaining countries received either a fair, 13 countries did so, or a moderate assessment. Thus, although the implementation was strong across the 30 countries analyzed, improvements are needed in policy design for more than half the countries. Next slide, please. As I said, we'll be looking closely at policy area M on opportunities in physical activity in schools, the community, and for sports and recreation, where all countries have taken action out of the 30 that we analyzed. However, a majority of these countries received a moderate assessment, and only 6 received a good assessment in this area. And we have there one that did, which is Denmark. This assessment was received when national governments had taken action across all benchmarks outlined there, and also that those actions targeted, in particular, people of all ages, targeted young people as well as least active groups. There are specific gaps that we found across the 30 countries. These refers to physical activities, policies that support physical activity outside school hours. So 12 out of 30 countries had not implemented actions there, and financial incentives to promote physical activity, where 19 out of 30 countries had not implemented actions at national level. Moving on. The index found that countries in Europe had implemented policies that were in need of improvement in their policy design in the remaining policy areas of the moving framework. That includes, notably, the two policy areas that look at active environments. So that is policies to visualize and enact structures and surrounding which promote physical activity. And we'll look at this in more detail on the next slide. It also includes policies on transport infrastructure, as well as other opportunities to support active transport. And here, most of the countries that implemented such policies received a fair assessment. 4 countries, Finland, Germany, Norway, and Slovenia, received a moderate assessment. And these countries had implemented policies to support public transport, road safety actions, policies to promote active transport, and as well as mass communication campaigns on active transport. However, these countries had received variable assessment with regards to policy design. So I encourage you to read more in the respective country snapshots to get a fuller picture. And finally, we have physical activity training, assessment, and counseling in healthcare setting. And we'll hear more on this from me in a minute as well. If we move on to the next slide. Looking more in depth at policy area V, which includes important policy actions around the built environment, like I said. Of the 24 countries which had implemented policy action within this policy area, most received either a poor or a fair assessment. We have there the example of France with a fair assessment, which shows many gaps in action, as well as weaknesses in policy design. The aspirational standards in this policy area refer to regulations surrounding design guidelines in and outside buildings for open and green spaces. And these regulations should target specific groups, such as, for instance, adolescents, people with all abilities, and least active groups. Across Europe, national government action was concentrated on walking and cycling infrastructure, which was implemented in 19 countries out of the 30. In contrast, the least action from national governments was on integrated urban design and land use policies, where only 4 countries had taken action. Finally, if we move on to the next slide, looking at the last policy area on physical activity training, assessing, and counseling in healthcare setting, we see here the example of Portugal, on which we'll hear more about in intervention from in the panel as well. But I will say that the aspirational standards here include training for more than one healthcare professional based on competency-based standards, which was a frequent gap we found across the 30 countries analyzed, as well as physical activity promotion that goes beyond primary healthcare and is given in other levels of the health system, such as outpatient care. So this has been a brief overview. If we go to the next slide. This has been a brief overview of the Moving Policy Index findings. You can find out more about how countries can improve policy design across all of these policy areas and benchmarks by consulting our policy brief. And you can scan our QR code there for a full version of our aspirational standards. Finally, if we move on to the next slide. It is important to contextualize these findings and be clear about what they can and cannot say. First, as an advocacy tool for civil society, we need to highlight that each policy area needs to be understood in the context of the benchmark we assess within the policy area, as we have shown by the discussion of selected policy areas today. Second, we need to ask specific questions on each country context. So, for example, are there countries where we're already seeing an environment that enable physical activity? And if so, what are their comparative levels of overweight and obesity? If they have a comparatively lower level of overweight and obesity, can this explain if they have taken less action across the moving framework and index? Conversely, in countries where we see environments that are less conducive to physical activity, one question could be whether they would take more policy action in response to this problem, depending on the prevalence levels of overweight and obesity, including with better policy design. So these are questions to kind of ask when using these findings in context. Third, we also need to highlight that this index only looks at national level policies, thus we don't look at provincial, regional, or local policies. At these levels, we know that these levels of actions are particularly important when discussing physical activity policy, which is also a fragmented area in itself, even at national level. So this consideration will impact in particular countries with a decentralized governance arrangement. Belgium or Spain come to mind, or federal countries as well. Fourth, we need to make clear that we cannot draw any causal conclusion between the overall findings of the index and any effect on overweight and obesity rates among adolescents. However, this set of tools that we have produced will contribute can contribute to the research infrastructure and can be used to generate hypotheses to be tested with robust studies. Finally, we are aware that there are other tools that look at benchmarking physical activity policies, such as, for instance, the GAPA monitoring and evaluation framework, other WHO tools, as well as the physical activity policy index, PAEPI. These are just examples. However, there are important differences in strengths of the moving policy index, such as the fact that we use aspirational standards in assessing policies, not just best practice criteria. And that we have produced a tool aimed at civil society. So we have made efforts to engage with governments, but because these tools are aimed at civil society, including youth, we primarily aim to support efforts in asking for accountability of these groups, in asking for accountability from national governments. And finally, to our best of our knowledge, there is no gold, as was mentioned, there is no gold standard on benchmarking physical activity policies. Therefore, this is an opportunity for cross-validation. I have reached the end of my intervention today. If we move on to the next, as I mentioned, we welcome more opportunities to engage with national stakeholders, including civil society, but also policymakers and researchers, in particular from countries we haven't heard from yet. And if you haven't done so, please consult the associated Nourishing Policy Index, which, as was mentioned, will also, the recording for that webinar will also be made available. Thank you so much.
Thank you so much, Joanna, both for an excellent presentation and also for the enormous amount of work that you and your colleagues have put into collecting these data and analyzing and then presenting them. Then we will move on to our panel, and the first presentation will come from WHO Europe. We have Dr. Kremlin Vikramasinghe, who has pre-recorded his presentation, but here today we're joined by Dr. Miriam Heinen, also from WHO Euro, and she will be able to address your questions later on. Briefly about them both, Dr. Kremlin Vikramasinghe is an acting head on the WHO European Office on the Prevention and Control of Non-Communicable Diseases, which is an integral part of the Division of Country Health Programs at the WHO Regional Office of Europe. And he is also the Regional Advisor for Nutrition, Physical Activity, and Obesity. Dr. Miriam Heinen is a trained dietitian and a nutritional epidemiologist who has worked for almost a decade on the topics of obesity, including being one of the lead investigators on the Childhood Obesity Surveillance Initiative the COSI, in Ireland. Since 2021, she has been working as a consultant for the WHO European Office on NCD with a main focus on obesity. So then let's hear from Kremlin.
Thank you for the invitation to WHO to share some remarks about the Moving Policy Index framework. And this is very important as we are working on improving physical activity across the EU countries and other WHO European countries. In terms of improving the physical activity agenda, the EU countries have done a very significant amount of work because of the collaboration between the WHO and DGER and setting up focal points network for physical activity. Together with the focal points from each of the EU countries, we have been able to create fact sheets about physical activity for each country. And these fact sheets to use 23 indicators, which covers many aspects from international physical activity recommendations and guidelines in each country, the cross-sectoral policy approach to promote physical activity, how national sports for all policy action plans take place, how sports clubs for health take place, different frameworks and target groups to address the physical activity. Also the health impact of physical activity, working with the education sector, with the physical education in primary schools are included, whether schemes for school-related physical activity promotion are available, how health-enhancing physical activity in training of physical education teachers is used, and also how environment and urban planning and public safety is working together, facilities for levels of cycling and walking in cities, how European guidelines for improving infrastructure for leisure time physical activity use. So these are series of 23 indicators that we use across all the EU countries to collect data and present about physical activity. Now, next step is for countries who have not been able to make advance, they need to get inspired and implement more programs to cover these areas. The best way to inspire countries is showing examples and policies in countries, in neighboring countries, or countries they like to learn from. Having a wide database where we have collected these policies according to an index and providing a framework really helps them to filter them through by themes, identify specific programs, examples, and for policymakers to get the confidence to implement. So this moving framework really helps countries to improve their score in our physical activity scorecards. Therefore, I hope that we can use this framework in our policy dialogues, national level policy dialogues, and inspire them to look at innovative approaches to implement them and also to learn from each other. Surveillance of physical activity levels is a challenge. Different countries use different methods. They are not all standardized across the region because traditionally these methods have evolved at national levels. Countries like to keep them. But objective measurement of physical activity levels is important. Alongside that, policy monitoring is also important in order to make a progress. While we are working hard to achieve the voluntary targets around physical activity, having all these policies implemented remains a priority for us. We have tools and networks such as the HEPA Europe network, which is a network of more than 200 scientific institutions in the WHO European region working together to promote health-enhancing physical activity. If we are from a research group, scientific institutions who's working to promote physical activity, please check on our website about HEPA Europe network, whether you are eligible and you can apply. Membership is free. And these are scientists and practitioners working together to support the implementation of policies. And they can use frameworks such as Nourishing in their work and now work to provide technical support to countries. Again, I wish all the best for the launch on behalf of WHO, but also look forward to working with all of you for the implementation and follow-up following this launch to make the maximum impact. Thank you.
Thank you very much to Kremlin. It is great to hear how he, from a WHO perspective, see the role of a tool like this, how that can support countries, both from a government perspective, but also for civic society. Then we move on to the next presentation, and we have Professor Marlene Nunes Silva with us. She is the director of the National Program for Physical Activity Promotion of the Portuguese Directorate General of Health. She is also a professor and researcher at the Faculty of Physical Education and Sport of the Lusofona University in Lisbon, with a sound record of funded scientific research projects and publications on exercise and health promotion. She has a pre-recorded presentation now, and then she'll be with us and respond to questions later on. Thanks.
Congratulations on the launch of this very useful Moving Policy Index. And my challenge based on our national score is to bring you a view from Portugal on the promotion of physical activity via primary healthcare. And I'm the director of the National Program for Physical Activity Promotion, which is a priority health program under the Ministry of Health. It was created in 2016. It's the youngest of the priority health programs. And we have four priority areas: monitoring and surveillance of physical activity and the determinants, communication, promoting awareness, literacy, readiness through population-wide campaigns, the recognition of good practices in community physical activity programs, and which I will focus today, the promotion of physical activity throughout the healthcare, our national healthcare system. So in this regard, there is a robust evidence and key guidelines on how to do this. So we didn't invent the wheel. We followed the recommendations and the guidelines in this regard, and brief intervention combines measurement and brief motivational advice. So several digital tools were created in a model of brief counseling through ministerial legislation in 2017. And we did a quick survey, but a national survey, and around 85% more or less of our doctors reported to do this promotion of physical activity in their practices. So we developed some digital tools in the national softwares that support primary healthcare consultations based on the premises of physical activity as a vital sign, as BMI, as weight. And this assessment serves the basis of the ecological surveillance of physical inactivity as a risk factor. So it serves to raise awareness as well and opens the door to the brief advice. So to support this brief advice, we also developed several motivational tools that are embedded in the system and that the doctor or the nurse can give to the patient. The goal is to improve the quality of the counseling, saving time and effort, because these guides can be delivered by phone, by email, by messages, or it can be delivered during the consultation. They are tailored to the readiness and physical activity levels of the patient, and they are based on solid scientific evidence. They are designed to be self-explanatory, so in case of no time, they can be explored at home. We have some guides with key information, guide with decision-making aids, guides with goal setting and action plans and coping plans, and guides more tailored to those who are in the maintenance phase of the physical activity. So with strategies to maintain that. We have several videos to support delivery and depicting real-world scenarios. They can be downloaded from our website. We have a national health smartphone app, which has embedded a physical activity card. It simply reads the accelerometer from the phones. And our challenge is to link this app to the digital systems so that besides the self-report from the person, this type of measurement can be embedded in the assessment as well. And we have several training activities and training resources. So we have a lot of digital training through different digital platforms, for example, from the psychologists working in primary healthcare, and through the national platform for digital learning, which is open to the overall population. We have several activities going on with this regard. On training, on counseling and assessment. We have several learning and training resources for free download in our website. And we also are part of this joint action, the OPAP, to transfer the good practices in Europe to our country as well. So we did also experiential learning with teams throughout the country to implement physical activity consultations. And we have materials in this regard. Here are photos from these training sessions. To support delivery and training, we have several learning materials, also you are able to do the download of these resources from our website. And we have other education materials with EOPAP, translating several materials. And we are in the process of develop educational manuals for physical activity in populations with special needs. So a lot going on. And in this case, in this arena, health, we received a good assessment, but in others, we still have moderate assessments, and in some cases, poor and fair assessments, namely regarding structures to support physical activity and commute. So to spread policies need to occur in different sectors of the society. So intersectoral commissions are really helpful. And in 2017, we create by ministerial legislation an intersectoral commission for the physical activity promotion. But, and it is recognized in the literature, the uptake of this multisectoral approach to physical activity has been slow because it requires cross-government collaboration and substantial investment outside the health system. So in Portugal, as in other cases, this is kind of suspended. It exists, but it isn't functioning right now. So we need to overcome this because the investment needs to be made in all sectors, following the Toronto charters, following the GAPA action plan for physical activity promotion. So we thank you for creating this index and helping us to identify the gaps at the national level and identified opportunities for action as well, with the target to improve current policies. Thank you.
Sorry for that. Thank you very much, Marlene, for excellent presentation, and congratulations on all the activity that you have in Portugal. And it is very nice to hear how you see that a policy index like this one then really is useful at the national level, both to point to the areas where you are doing well, and then also the areas where there clearly is room for improvement. Then we will go to the final panelist, Jacob Schouwenborg. He is the Secretary General in the International Sport and Culture Association, ISCA, a global platform open to organizations working within the field of sport for all, recreational sport and physical activity. And Jacob has been responsible for the operations of ISCA for the last 14 years, implementing more than 70 Erasmus plus sport and other EU projects in ISCA, and driving ISCA's advocacy and partnership efforts. So welcome to you, Jacob.
Thank you very much. Thank you for that introduction, and thank you for the invitation to be here today. It's my pleasure to comment on this opportunity that we do see with the moving database and the moving policy index and benchmarking tool. So I'll start first by explaining a little bit about who we are in ISCA. If we take the next slide, please. We are fundamentally an umbrella of national organizations that are focused on physical activity, grassroots sport, and play. And if we take the next slide, please. You will see that we then actually do not engage citizens themselves in physical activity, but we try to engage and help support indeed our members across the world that are delivering these activities, recreational physical activities and sport for ordinary citizens every day. So this means that yes, we have sport in our name, but we really are not related to what you watch on TV in terms of professional football for men, but rather to the day-to-day physical activity for ordinary citizens. If we take the next slide. We are happy to have this membership, and we're happy to engage so many individuals and organizations in that regard, but we really are also very keen to work with new partners and try to understand what is the relevance of grassroots sport, what is the relevance of physical activity to other sectors, to other societal problems. And obviously health is one of them. We've discussed today about obesity, non-communicable diseases, etc. And we believe strongly that the grassroots sports sector has an important contribution to make. If we take the next slide. I will give you my key takeaway really here at the beginning when we talk about how to be an advocate, how to push for more physical activity, better policies, better investment, etc. We would really recommend to not just say that we need more, to not just use the moving database and the benchmarking tool to say this is bad, we expect and demand more from our policymakers. Rather, I would recommend that we together try to persuade and engage in a dialogue that allows us fundamentally to offer our help to solve the problem. I think many politicians, my understanding, are very happy to receive good advice, especially if you have solutions to follow up on that advice. So offering your help is really a helpful way of thinking about advocacy in my mind. If we go to the next slide, I would just say that for us to see finally the launch of the moving database policy index and the benchmarking tool is fantastic, because our member organizations, so physical activity advocates, fundamentally really now have the tool that they can use. They are typically already engaged with the national governments in terms of how to invest, what to do to promote more physical activity. And now they have a tool to help that dialogue along. They have a tool to engage with the policymakers, but then also to push a little bit stronger towards better and more policies for physical activity. So I think this is a fantastic tool, and what we commit to doing in this case really to not only share the tool with these member organizations, but take bilateral conversations with each of them. What would they need to do more? How can we in ISCA as an umbrella help them in their advocacy efforts? And this is something we're happy to do in the coming weeks and months. So thank you from our side also for the great work done, and I think it's a really impressive and powerful tool that you have created. Next slide, please. We also commit to working with key stakeholders internationally. In this case, we don't work specifically with our members, but directly engage in the policy dialogue, not least with EU stakeholders, WHO, who we heard from today as well. And our commitment really is to make sure this is not just about sport or grassroots local sport clubs, but rather to say what is it that physical activity can do in a broader sense to promote healthy lifestyles, well-being, indeed social inclusion, etc. So this is also what we intend to do based on the moving database and the benchmarking tool. Next slide, please. What I would also say here at the end is that we really, really hope to be able to engage different kinds of groups, different sectors. We've heard from Portugal, it's not always easy when you bring these different ones together, but as Joanna also said, obviously, nobody seems to own the physical activity space. I think Joanna used the word, it's fragmented. So if nobody owns it, who's going to lead it? I think we don't have to have one organization or one entity, one sector leading the physical activity space, but bring together different stakeholders to push for better policies indeed. And we are here to offer and to commit to being part of such coalitions and hopefully finding stakeholder groups that are all engaged in this common goal of the promotion of better physical activity policies. So next slide, please. We hope to be able to show what this means in practice. We would like to use and to offer our Now We Move campaign. So we deliver something called No Elevators Day, the Move Week, the European School Sport Day, physical activity campaigns, and sometimes having something tangible to show and talk about to the politicians can be helped. So if anybody around this webinar would like to use some of these campaigns or work with us, they are most welcome indeed. We hope to be able to walk the talk, as they say indeed. So with the final slide, I would like to end my intervention. Thank you very much again for the opportunity. I'm very happy to discuss, to take any questions, and for sure we commit to working and using the moving database as we go ahead. Thank you very much.
Thank you very much, Jakob. This is great to hear how you see a tool like this really being useful in your advocacy work. So much appreciated. Then we have time for questions. We have quite a few, but are open for more questions if there are any from the audience. But I can start out by asking WHO, Miriam. Now we have presented this civil society tool. Could you say something about how you, from WHO perspective, see that you can that these kind of tools can support the existing work that you are doing within WHO Euro?
Thank you, Professor Klepp. First of all, for inviting us, and it's great to see this launched because it's a very, very useful tool. Well, mainly, you know, what we definitely will be using it for, there will be many things, but like a few things I want to highlight here is like we have policy dialogues with countries, with our member states, and this tool is then really, really useful because we can quickly provide an overview of the countries, you know, like of the 30 countries that have participated like in development of this tool, and we can really highlight what is already put in place. So that's really, you know, one thing that is very important. And also we can use then this tool even to inspire these member states as well, like, okay, this is already done in other member states, and to really inspire them to do similar innovative approaches in our region. And then as well, and this was already mentioned by Dr. Vikramasinghe, is we have the WHO Europe network, HAPA Europe, and they are really focusing on promoting physical activity in our region. And they will also really be able to use this tool for them as well in their work and their activities. So those are just like a few things, but I'm sure we can come up with more usage of this. Thank you very much.
Great, thank you. That's really great to hear. Jakob, back to you. You gave a lot of concrete examples of how you think this tool can be used in your advocacy work. But you also mentioned the fragmentation that we see in the area of physical activity. And very often, you know, people are asking for the one policy measure that's really is the one that's going to solve the problem. Do you see any way that a tool like this can help make it more cohesive and that can be useful in your advocacy work?
Yes, I would love to have a silver bullet, one specific solution to rule them all. Life is not like that, I'm afraid. So what we can do, what we can use this benchmarking tool for, is to be a little bit clever about our advocacy. And I think what we need to do is to be bold and to take the database to make some some comparisons, to say, look, Danish government, you look pretty good in these areas, but you're falling behind these other 3, 4, 5 countries in these areas. it's not good enough. Or you are leading this space. To be able to keep this leadership position, we need to do this and that. So we need to provoke a little bit, and maybe we can even build upon not only the moving database, but the nourishing database and other tools as well. And so what happens if we compare how one country is doing in the moving database with how it's doing in the nourishing database? Is there a correlation here? How does that stack up against the obesity data in that particular country? Are there also some other factors we can take into account? And just be clever, and also a little bit, I would say, aggressive, or at least very pointed when we talk to politicians, because we have to appreciate that policy agendas shift. Nowadays, there's a lot of focus on the cost of living. There's a focus on crisis after the war, during the war that's happening in Ukraine. There's a lot of focus on energy, the green transition, etc. I am sorry, but physical activity is not on that list right now. So we need to attach ourselves to some of these ongoing, pending, and higher agendas to be relevant and to be heard, indeed. So our recommendations would be bold, but then also to make sure how your agenda fits to other key agendas at the time.
Yeah, thanks. I think that really is an important point, how we can play into others' agenda across sectors. And Marlene, you gave a really nice overview of a lot of activities going on in Portugal. How do you think the snapshot from Portugal will be perceived and received by the politicians in Portugal?
Well, in one hand, thank you for the question, and thank you for having us. It's really important to see a good practice recognized. So in terms of health, this was really well received, and it was like pushing our agenda that it is worthy of promoting physical activity in this sector. It is also important to show that other sectors need to pick up the speed, mainly in terms of infrastructures, mainly in terms of stimulating cycling and walking environments. We are not so well in this type of policies. So it's good, and it helps the advocacy in this regard. And it helps to try to put this intersectoral commission working again, because right now it is on hold. It is the biggest challenge in terms of physical activity promotion. I feel that the sectors work against each other and not in collaboration as they should. So it is our challenge in our country, as in other countries, to work together and to monitoring our progress in different areas. And this type of tools helps a lot.
Thanks. Yeah. So creating some competition here and would be good. Thanks. Joanna, we've had some questions about the applicability of these tools outside Europe. Europe, of course, is quite heterogeneous, and you've applied the tool now in very different European settings. Do you see applicability in other parts of the world as well for this kind of tool?
Thank you for this question, and absolutely. So this tool, while it was applied in Europe, where we were able to collect this comprehensive data set of policies using the methodology associated with our moving database, the benchmarking tool, etc. So using the tool in its entirety does require the existence of a comprehensive data set in that way. However, we have in collaboration with colleagues from University of Cape Town, for example, as part of the Co-Create project, we are applying these tools on policies on nutrition as well as physical activity from South Africa. So watch this space on the emergence of that. So I would say it is possible that there might be some attributes within the benchmarking tool that may or may not be relevant in specific settings. So that's something to test. However, the only overall requirement for applying these tools right now in other settings than Europe is having that comprehensive data set. The tools can be used in assessing specific policies as well. As I mentioned, the QR code, we had them with regard, so you can use that and you can consult the aspirational standards in full. So if you're only interested in one specific policy area, you're able to really quickly look through the aspirational standards and assess specific policies. But of course, you wouldn't be able to have an overall kind of score for the policy area or anything like that in the absence of a comprehensive data set.
Great, thank you. I see we're running out of time, but just one quick follow-up question to you, Joanna. You said that this tool is focusing on national policies. Do you think it would be possible to adapt it and apply it in a local setting?
Well, it would be, but of course the data, for us, it was the data considerations of how you would be able to collect all of the data. So in the absence of that, we weren't able to do so, but yes.
But maybe other organizations working at a local level might be able to take some other concepts and apply it in a local setting as well.
Yeah, I think they could. Thanks.
Well, great. Thank you so much, everyone. Really appreciate you coming and attending our seminar. It will be, we will provide linkage to the recording to you so that you will be able to visit, and we also hope that you will visit our websites and download the tools. So thank you very much to all of those of you who attended this webinar. Thank you to the speakers and the panelists. Thank you all, and bye.